Welcome back to the start of the second week of ICD iCAMP at the World Health Organization in Geneva, Switzerland. All of our iCampers have made it back from Mont Blanc, and they are refreshed and ready to start another productive week. After the focused and specific review of last week, our managing editors and classification experts had the opportunity today to re-examine how each one of the components we have covered so far fits into the workflows in general. This is a chance to see the big picture together with the small details and to better understand what the combined efforts of all of the participants will accomplish. In order to do this, it is necessary to revisit the life of a content proposal from start to finish. In the beginning, a content proposal for ICD-11 will be created by a collaborative author. This author may be a government-supported content expert, or the member of a classifications group, or a private individual, such as a clinician or an academic member of a research institution. The beauty of a collaborative authoring tool, like the iCAT, is that it allows the creation of the ICD-11 to draw upon the expertise of anyone, at any time, anywhere in the world. After a proposal is created, the managing editor must serve as a postmaster, ensuring that the content proposal is complete and correctly formatted.
In our general workflow, the managing editors will be in charge of editing the content model.
They must also ensure that it is thoroughly supported before they forward it on to the specifically chosen group of identified independent peer reviewers.
We will have a minimum of 3 reviewers, and once the reviewers review the content, they will send their feedback back to the managing editors.
It is also the job of the managing editor to filter out or address those proposals which do not completely fulfill the necessary criteria. Those content proposals which receive the appropriate percentage of approval by the peer reviewers will be passed on to the topic advisory group for further review. It is the job of the topic advisory group to evaluate the content proposal and the supporting information provided.
Topic advisory group reviews the content here, and they may, if there are issues that they are not happy with, they may send it back to the managing editor for further edits.
Each of the content proposals which reaches this stage may also require review by other parallel tags if the content proposal includes information which overlaps multiple tag areas. Each proposal which meets the exacting requirements of the tag or tags will be passed along for further evaluation by the revision steering group.
However, if they cannot agree, they can also send the proposal to the RSG, but this time with a conflict flag raised. And in this case, RSG will look at this issue and knowing that the tags didn't agree with the content. Once the conflicts are resolved, or once the information comes to RSG without any conflict, RSG works on them, and if they approve, the information, the content goes to the WHO for their review.
This process ensures that the information to be included in the ICD-11 meets the highest possible standards, which in turn ensures the best possible resource for users in the field.
The revision of ICD is very important for Japan, and that's why, as the Japan Hospital Association, we are supporting the work. I believe iCAMP is going to be a big step forward in advancing the work.
But we are not done. All of this is merely part of the alpha drafting process, and we will have more to do before we can be sure that the ICD-11 is both perfect and perfectly functioning. Come back tomorrow for more ICD iCAMP.